Good afternoon. Today is Tuesday, March 1st. This is the Public Health and Safety Committee. We have a quorum with myself, Councilwoman Gamble, Councilman Nash, Councilman Pulley, Councilman Rosenberg, Councilman Taylor. I do have a consent agenda, and so I'll read off these bill numbers or resolution numbers. If anybody has anything they want me to pull off, let me know. I've got RS 2022-1402, then 1403, 1404, 1405, 1406, and 1409. Does anybody want any of those pulled off? Okay, then I will start reading. RS 2022-1402, Allen, Welsh, and Evans approves a grant contract between the Metro Board of Health and the Mental Health Cooperative to provide outreach, assessment, and linkage to care for individuals identified as part of the opioid overdose response program. RS 2022-1403, Allen, Evans, Welsh approves a contract between the Metro Board of Health and Nurture the Next to provide funding for a program coordinator for the Collective Impact Initiative, ACE, Nashville. RS 2022-1404, Allen and Evans approves a memorandum of understanding between the Metro Nashville Police Department and Tennessee Bureau of Investigation for the MNPD to provide qualified officers and assist the TBI in drug overdose investigations. RS 2022-1405, Allen, Evans, and Hancock accepts a Paul Coverdell Forensic Science Improvement Grant from the U.S. Department of Justice to the Metro Nashville Police Department to increase the toxicology unit's capacity to process cases more efficiently, reducing turnaround time and backlogs. RS 2022-1406, Allen, Evans, and Hancock accepts a DNA capacity enhancement for backlog reduction program grant from the U.S. Department of Justice to the Metro Nashville Police Department to assist the forensic biology unit in outsourcing case sample analysis and purchase equipment to streamline DNA interpretation. And then RS 2022-1409, Allen and Evans approves an application for a hazardous materials emergency preparedness grant from the Tennessee Emergency Management Agency to the Metro Office of Emergency Management to provide resources to procure items, training, and/or equipment for hazardous materials, hazmat preparedness. Do I have a motion?
So moved.
Do I have a second? Thank you. It's been moved and properly seconded. All those in favor of the consent agenda, please say aye.
Aye.
Anyone opposed? All right. Okay. Next one is RS 2022-1408. Accepts a donation from Adler Horse International to the Metro Nashville Police Department of training courses for I'm sorry, I skipped one. Let me back up. RS 2022-1407 accepts a donation of an untrained police dog from the Cornerstone Church for the Metro Nashville Police Department to utilize in patrol tracking or the detection of explosives or narcotics. Do I have a motion? I have a second. It's been moved and properly seconded. I just wanted to take this off consent just because some of what you said yesterday in budget I thought would be important for people to hear.
Sure.
About the donation, and I just also had a question. It didn't sound like you already have the dog.
No, we do not have the dog.
Okay.
So basically I was asked yesterday how the donation came about. And essentially what happened is one of our canines, House, unexpectedly became ill and passed away very quickly from a disease. And my understanding is members of the church saw the news story that was run about it and started collecting donations to provide another dog. And so I was asked if we had the dog. We don't have the dog. I think what has happened is they have paid the company that we normally use to acquire our dogs, and then so the dog is ready. If this is approved by council, then we can take acceptance of the dog, but we don't have it yet.
Okay, thank you for sharing that. Rosenberg.
Commander, did House do explosives or narcotics, or do they do both? Do your dogs do both? How's that?
So dogs, some of them are exclusively patrol canines that are aggressive canines. A lot of them are cross-trained dogs, but we do have a couple that are non-aggressive explosives canines, and I'm not sure exactly which one they intend to use this particular dog for. I'd have to check with our canine division.
Got it. Okay.
Councilwoman Gamble.
This is wonderful. I appreciate Cornerstone Church for making this donation. Just a question about the value, and that may have come up in budget. Most donations over $5,000 have to go through approval for council. What would be the value of this donation?
I believe that the invoice was $11,500. Yeah, it's expensive.
Thank you.
How about any other questions? All right. All those in favor?
Aye.
Anyone opposed?
Me.
Okay, got one. Okay. RS 2022-1408 accepts a donation from Adler Horse International to the Metro Nashville Police Department of training courses for 2 MNPD K-9 unit trainers.
So moved.
Thank you.
Second.
All right, it's been moved and seconded. Same, if you could share what you shared in budget.
Sure, it's, well, I didn't actually get to speak on this one, I think this was on consent there, but
That's
this
true.
Is a donation from the company that provides, is a vendor for the dogs, but they also do canine training. It's a train the trainer type training, so it would be 2 of our handlers go out there, receive the training that they bring back here and train our other canine handlers.
And I know that I was tagged in some information about this particular company. Is this the only company that you all use to acquire police dogs and do training?
This is the vendor for the police dog. It's the only one that I'm aware of.
Only
We did
one.
have one, so what I mentioned last night was we did have a vendor in Alabama that we used for many years, but we had started noticing some health issues with the dogs from that particular vendor, so that's when the switch occurred, and I'm not exactly sure. It's been the last few years. I'm not sure exactly.
Got
when
it.
that date
Okay,
was.
because I was trying to reflect on like going through the Citizens Police Academy and that process, and I'm like, gosh, that doesn't sound familiar to me. Anybody else have any questions? All right, all those in favor?
Aye.
Anyone opposed? Okay. I'm gonna vote no on this one, so. All right. Let's go to the late item for me. A resolution in support of life-saving responses to the recent escalating overdoses largely caused by widespread availability of synthetic illicit drugs. This will be in front of rules next because it is a late file. And as far as the content is concerned, I worked with Dia Cirillo, who I'll recognize here in just a second, to speak to some of this. But basically, I've set up a public hearing for our committee on drug overdoses. If you remember, back before Christmas, I had shared some information from the drug overdose response unit from the health department. And the problem is continuing to escalate about drug overdoses, and we need to amplify, some of the work that they're doing. In addition to the content that's included in this resolution, one of the things that has been announced as of this past Friday is the opioid settlement. And so I'll recognize Dia if she wants to share some information really about kind of the synergies of us recognizing that this is an issue and that the settlement is coming to Tennessee and what that really means for our county.
Great. Thank you, Madam Chair and members of the committee. I really appreciate this opportunity to speak. My name is Dia Cirillo. I'm Senior Policy Advisor in the Mayor's Office. I was delighted to work with Councilmember Evans on this resolution. There are a number of things that are coming together. One is that we have been watching an ongoing, really folks are calling it an epidemic of overdoses, fatal and non-fatal overdoses. Last year we clocked in at about 700 fatal overdoses, and we've seen an increase year over year over the last 3 years. It's a concomitant epidemic along with the pandemic, okay? And so the opportunity for Metro Nashville is really to understand what this is about. It's about widespread availability of illicit synthetic opioids and stimulants. Certainly there's a lot of very good work being done between the Public Health Department as well as the Police Department on this front. We have an emerging national model at the Public Health Department with the Overdose Response Program. They have done some excellent data to action work around that, and I think you've seen some of the grants in your current consent agenda for that program. What's going to be important is for Metro Nashville to understand the implications of this and really what are some very important immediate next steps for Metro to begin to think about. This resolution is really just a statement of support around this is a problem and we need to start thinking about solutions around it. And some of those solutions are very immediate, crisis response, rapid referral to services, connections to care. And that's the place to begin around saving lives. Certainly there will be more work to do over time. The opioid settlement as it comes in, it's very specifically focused on prescription opioid, really around the crisis of prescription opioids. And that settlement is about $27 billion over 23 years. That brings in to Davidson County a little over $1 million a year, each year. Authorization goes to the mayor's office. Certainly we're in the process of conversations with public health, looking at what are some opportunities as we move forward as these funds come in. We've been told that the funds will come in. There could be a first, the state will get some funds that we would have access to in May, and then a second drop in July. And so with that happening, some of those funds could absolutely be used for rapid referral, detox, medically assisted treatment, things that really need to be in place to begin to save lives. I think one of the things that's really important for everybody to realize around the overdose crisis is a couple of things. One is, first of all, substances like fentanyl are in every illicit drug that is out there, and in Connecticut they have identified it in marijuana. So it's much more widespread than I think people have previously realized. It is lethal. It is 80 to 100 times more potent than morphine. So it is very dangerous. And right now in the state legislature, there is a bill to make naloxone much more widely available and to be more available almost on the level of a defibrillator in public so that people know how to use it and can be distributed through nonprofit organizations and churches, et cetera. So there are efforts to really increase our attention around this and our capability to intervene for life-saving measures. So thank you for that opportunity.
Yeah, thank you for your explanation. And if you didn't see the news story this week, Metro Schools, there was a story in Main Street News about all of the SROs being trained to use naloxone. It's, because of what you just said, talking about pot and everything else, it's permeating down to a much younger level. And so our special call meeting is on Thursday, March the 10th at 5 p.m. in the council chamber. And so we'll have experts in addiction and then also representatives from the Drug Overdose Response Unit, Josh Love, as well as the speaker, to speak specifically about naloxone and the work that they do with that. So how about any questions for me or Dia? No? All right, I'd like to renew my motion for approval. All right, all those in favor?
Aye.
Anyone opposed? All right, thank you for that. Let's move on to bills on second reading with BL 2022-1114. Amends the Metro Code of Laws, and it's from Councilman Mendez, amends the Metro Code of Laws pertaining to the use of license plate scanner LPR technology to add a definition of personally identifiable information. I'll recognize Councilman Mendez.
Thanks, Chair. I'm going to ask the committee to recommend deferral for 2 meetings, but I'd like to provide an update about why.
Okay.
You want me to go ahead, or you
Sure,
want?
go
Okay.
for it.
Thanks. First, generally about these three bills quickly. When we got done with the debate and took the vote, it felt to me like there were some general principles that both sides of the debate agreed upon, and I tried to pick things that I thought both sides agreed on. One, there wasn't any definition of personally identifiable information. Secondly, everybody seemed clear that we didn't want to use our LPR data for immigration. And third, there was a strong commitment to civilian oversight. So in this one, 1114, this is the one that would add a definition of personally identifiable information. And So I've been in conversations with the administration, and frankly, as I was getting over COVID a couple weeks ago, I ran out of time to get to the end of the conversation. That's why I'm asking I'll recommend the 2-meeting deferral. There is no definition in Metro law about personally identifiable information. The state's got a handful of definitions. The federal government's got another couple handfuls of definitions. What we passed several weeks ago allows different departments of Metro to come up with different definitions. At a minimum, we should take that off the table, so there's just one definition for Metro. The administration's feedback was that they thought the definition was overbroad. The one that I found was one of the federal law ones, and I promised them I'd think about it. Frankly, the pushback I got has made me think the right thing to do is just take the personally identifiable information out of the bill. The fact of the matter is that LPR data is used to connect cars to human beings, and so the sales pitch reason that no personally identifiable information was put in the bill in the first place was always apparently not going to be accurate. We are going to keep personally identifiable information. That's the point of LPRs, is connect cars to people. So I want to take the time to figure out whether to amend the definition down to be essentially meaningless, or to just leave it be and let the departments come up with whatever, or see if there's some other consensus that we can come to. So it's not really ready for prime time, and that's why I'm asking the committee to recommend deferral for 2 meetings.
All right. Any questions for Councilman Mendez? All right.
Move for deferral.
All right. You got one? Okay.
I mean, I appreciate the dialogue and the debate with my friends on the other side of this issue. We are kind of diametrically opposed on the issue of LPRs, and I just wanted to ask this one question. When I look at the sponsors, I mean, I just want to see what the playing field is here, because are we really and sincerely trying to get to definitions that make sense, or are we really trying to get to a place where the bill is being made and affected by some of these bills here? So I would ask that of the sponsor.
Sure, I don't have any idea who the co-sponsors are. I haven't looked. I've been anecdotally told that there's people on both sides of the vote that have added their names to one or more of the bills. So it seems like I haven't looked, but somebody told me Cash is on all 3 of them, and I think Berkeley's on some of them. Council members Cash and Allen, and so I'm not doing anything to round up people, and I'm told that there's sponsors from both sides of it on all the bills. My intention is that we got told hard, and there seemed to be consensus on both sides of the debate, like, we're not going to keep personally identifiable information, and so I tried to come up with a definition. The pushback is, oh no, we're going to connect license plates to people. That's the point. And so again, the thing I am thinking about in good faith is does that mean that we should just remove the claim that we're not keeping personally identifiable information? Should we go with a very anemic definition that lets plates be connected to people? Or those are the things I'm thinking over. And again, I don't want to lean on I was sick for a week, but I was sick for a week and didn't really get to the finish line.
Well, let me ask you that point, because my understanding is a bit different. What we're keeping, the information that we keep relative to LPRs, and I'd ask Commander Gill this question, is the information we're keeping the actual license plate itself? Is that the data that's being kept for the 10-day period?
Yes,
the picture of the license plate itself. So in order to get personally identifiable information out of that.
With a date and location stamp.
Yeah, but don't we have to cross-reference another data set in order to get personally identifiable information off of a license plate?
The system doesn't exist yet, right? So.
Right, but the design of the system is to take a picture of the license plate.
There is no system yet.
Well, the design of the bill, the intent of the bill is just that.
Well, may I interject
just
go ahead and finish your statement.
What I worked out with the administration was that they raised a point. I'm thinking about it. So I'm not really. That's what I'm saying.
I just want to go back to what you were asking about as far as the kind of intention. Like, I signed on for the PII definition because that's my day job is identity theft remediation and data breach remediation. And that was part of my reluctance to be in favor of the LPR legislation to begin with, because I know how easy it is to connect the dots between data and just for my day job. So that's, my goal is really to get to a definition I think that would be workable. So I can't speak for anybody else, but that's why I signed on to it. So I just wanted to pass that message over. Yes, sir.
From my understanding of it, the LPR data is not personal data, outside of the fact that there's a tag that belongs to somebody. But what's saved on LPRs is the license plate with a date and stamp, time stamp, and location stamp. All that other information about whether you have a criminal record or where you live is all on other criminal databases that are used every day. Policeman gets on the radio and said, I need to check on warrants on so-and-so. It's already there. They're not the same. Now, yes, let's not be too coy here. Obviously, if we're after some stolen car, we're going to try and connect that car to a person.
Absolutely. Once it's cross-referenced with another data set.
Okay, Councilman Rosenberg.
Setting aside the fact that there are LPRs that take pictures of the drivers too, you can say the same thing about social security numbers. Until you match it to the person's name, then it's just a number. All that aside, the bill specifically says we're not going to use personally identifiable information and doesn't define what personally identifiable information is. The bill that Councilman Mendez brought creates a definition for a term that was made up out of thin air and was one of the many problems that were identified with this piece of legislation, no matter which side of it you were on philosophically, and we should fix it.
And no matter what, we should make it so different departments can't have different definitions. No matter what. NDOT shouldn't have a different definition than the police department for the exact same stuff. And so I promised Mr. Jameson we'd keep talking about it, and I've mentioned the other committee meeting, but the reason for 2 meetings is we're going to have spring break next meeting. We're going to lose some people, and so 2 meetings gives 4 weeks for me to have a conversation with the administration, and maybe we get to a happy place. Maybe we have to fight about it.
Councilman Butcher.
Thank you so much, Chair. So, Mr. Jameson, how do we go about establishing a definition for PII across metro government? Because this is only just limited to the LPR legislation.
I am not a specialist in implementing and how LPRs are implemented. I can barely spell LPR. So what we did was that we took the legislation. We had heard from counsel for various vendors. And so we reached back out to those councils and said, would you take this definition to your company and simply ask, could your company operate a standard LPR process with this definition? They speak up here and I'm down here. I will tell you the example I remember from one company. The gentleman said that the majority of Amber Alerts are actually kidnappings by a non-custodial parent. So let's say the custodial mother phones the police, my ex-husband has our daughter, here's his tag. Somewhere there's an LPR that captures a tag going through an intersection, and if implemented as intended by the bill, captures the plate, the date, and the time. And that's all it should capture, not Social Security, not eye color, nothing else. But at some point, that is matched up to the list of here are license plates, and here's the one that belongs to the guy that just kidnapped your daughter. That cross-referencing, the representatives thought would violate the definition because it prohibits even indirect identification. I think there's a happy medium that allows the cross-referencing, but still make sure that the device itself does not capture the data that the council would not want captured. We just have to spend a little time on that nuancing, and we both ran out of time.
But how do we reconcile what Councilman Mendez stated about different departments not having multiple definitions of what PII is?
No, I think that's totally legitimate, and I think we can have a uniform and consistent definition. As long as it doesn't prohibit the cross-referencing, I think that, and I'll take whatever definition is thrown out there back to the vendors just to say, on a practical basis, does this allow, at least for the pilot period, actual implementation? And that's kind of who we've been conferring with.
Have we had any conversations? Will social services be part of that conversation too? Because they deal with a lot of PII too.
That's a good idea, and I will bring them in.
All right. Yes, sir.
Have we moved the deferral?
We did.
No.
One more question.
Oh, okay.
So we did. That's what we were discussing.
Mr. Jamison, is Vigilant one of the vendors that you're talking to?
There are two that were identified by name and a third one that was not identified by council. So could be, but I don't have any reason to, I'll ask, but I don't know.
Okay, thanks.
Any other questions? All right. All
I
those,
move the deferral
Yep.
from 2 meetings.
Second.
yeah. All those in favor?
Point of order, are we moving deferral for all three bills?
No, I just did the first one.
Okay, that's fine.
Thank you for asking. All right. So we've got a 2-meeting deferral on that. BL 2022-1115, amends the Metro Code of Laws pertaining to the use of LPR, license plate scanner technology, to exclude assisting with immigration enforcement as an allowed use of LPRs. Councilman Mendez, do you have anything else you need to add, or are we just going ahead with 2 meetings?
We're on 11:14 still?
15.
No, we just voted.
Oh, 11:15?
Yeah.
I'm sorry, I was daydreaming for a second. Apologies. On 11:15, I'm also going to ask that y'all recommend a 2-meeting deferral, but I'd similarly like to just update you guys on the state of things I've heard and the reason why. This one is definitely one where I felt like 37 out of 39 people in the room were probably in favor of never, ever, ever, ever using the data for immigration enforcement. And Chief Drake and NDOT wrote a joint letter to us saying, quote, LPR information will not be shared with ICE for any type of immigration enforcement. And so the idea was just to put that in the law. You've seen the analysis saying that it would violate state law. In the other committee, I confirmed with council that not only, the position is that not only would it violate state law for the council to make a policy to not share the data with ICE, it would also violate state law for the police department or NDOT to have their own internal policy to not share information with ICE. So apparently under state law, if any employee of either department wants to share it with ICE, that's going to happen because we can't make a policy about it. The second part of the bill is saying we won't use ICE's hot list, and the analysis says that maybe that doesn't violate the letter of the law, maybe only the spirit of the state law. Taking that information, frankly, again, I want time to think about it because I've spent half the time since the last meeting being sick, is whether to push it to a vote, even with the analysis being what it is, and let people vote however they want, or maybe water it down so it only talks about not using the ICE hot list because that's apparently less overtly violative of state law. And so anyway, now you're up to speed on everything that's happened and the feedback I've gotten, and that's the reason I'm asking y'all recommend a 2-meeting deferral.
I move 2-meeting deferral.
All right.
Second.
It's been moved and seconded. All those in favor?
Aye.
All right. BL 2022-1116, by Mendez, Rosenberg, Allen, and others, amends of the Metro Code of Laws pertaining to the use of license plate scanner technology to ensure data access parity for the Community Oversight Board. Councilman Mendez.
Thank you. On this one, I'm going to ask you to recommend approval. The Transportation Committee recommended approval a few minutes ago. This one, there were 2 places where the public defender and the DA had access to information. One was to quote, investigate complaints of misuse of an LPR, and the other was access to the audit trail. And this bill would put the COB on parity with the PD and the DA's office in connection with both of those access to information.
All right, anybody have any questions for the discussion? Any discussion?
I have a quick question.
Sure, go for it.
Would, there's a state law that governs the COB and their authority and their access to information and things like that. Are we in any jeopardy there at all?
No, both sections in the bill start with, to the extent consistent with state or federal law.
All right, any other discussion? All right, Councilwoman Gamble moves approval. Second, all in favor?
Aye.
Anyone opposed?
I'm just going to abstain.
You're gonna abstain, okay. All right, and then, thank you, Councilman Mendez.
Thanks,
Bill 2022-1120, Evans Allen Swara approves a contract between the Metro Nashville Police Department, the Mental Health Cooperative to ensure provision, integration, and implementation of mental health training for Metro Police Department personnel by mental health cooperative clinical personnel. All right, it's been moved. Second? All right, any discussion? All those in favor? All right, anyone opposed? All right. Just two quick things before you guys will walk out. I mentioned the special call meeting on addiction and overdoses. We do have a conflict. I wanted to recognize Commander Gilder so he could share information about the meeting that MNPD is going to have.
Yes, thank you. So the police department, when the resolution was approved to purchase the upgraded tasers and de-escalation training and virtual reality, part of that resolution, there was agreement for us to host a community meeting so that Axon could demonstrate this technology, answer questions, things like that. We have worked out a meeting. Unfortunately, as Chair mentioned, it is on March 10th. The reason we were trying to go ahead and get it scheduled is because there is a purchase order in place, and we wanted to make sure that this was rolled out in time for the community to see and ask questions, and council too, prior to the units actually being delivered and issued. So it's going to be Thursday, March 10th at 5:30. It will be at the Nashville Music City Center. There will be members of Axon on hand, as well as our MNPD training staff. So Axon to talk about the technology, our staff to talk about training, and the council's invited, community's invited, we invited the COB. So hopefully that will answer questions about the technology and training. They'll have the ability afterwards to interact too, and one-on-one get questions answered if there's any of those. We will also, because of I realize that with the conflict there, and some people might not be able to make it on a Thursday evening, that we will film it as well and provide that to Channel 3 so that it can be posted, so in case anybody can't make it and still wants the information.
Thank you, Commander Gilder. All right. And last but not least, Mr. Sharp, did you have anything you needed to share about COVID response?
That perfectly. I just walked it off my. So we're moving towards endemicity. I think to the extent that anything is still being done, we're looking at. You had asked last time, when did we start rolling back the testing centers and all that? Dr. Wright, the numbers are trending very well. We're below 20 per 100,000 for the first time since last year sometime. We're down to 18 something. We're up to 60 now, almost 70%, at least one dose, 65% fully vaccinated. The numbers are really trended down. He wants to see what we look like 2 weeks after spring break ends, to see if we brought back any nasty bugs between then and there. And I think after that, probably we will move to a full sort of endemicity approach to things. We'll still have the traveling strike team vaccination events and all that. That'll continue for the foreseeable future.
Councilman Rosberg.
Thank you. When you say 20 per, when you give numbers, that doesn't include anybody who's taking home tests, which is the vast majority of people. Okay. The CDC still has us listed as high risk. How frequently do that, while Shelby is low risk? Why is that, and how frequently is that updated? And do you predict or project we're going to get knocked out of high risk anytime soon?
I would think so. Given the way the numbers have kept trending down, you looked at 14-day average, the 7-day average, the 7-day average is consistently lower, which means it's going to continue to come down. I don't know exactly, I'll tell you the truth, I don't know where they draw the line.
What's it based on? Is it based on case count or attack rate?
I think it's per 100,000, I think. And that 18 is really a lot better. We've got 3,600 active cases now. We were up to 16,000 or something at the height of the Omicron. I mean, it's really dropped off the table. But it doesn't mean it's not out there. But the hospitalizations, ICUs, deaths, all of that is stable or down. So the hospitals are okay, which is really what you're worried about most probably. So I don't know the answer, David. It'll be, I hope it's going to be relatively soon. They're moving towards just generally backing off a lot of things. They're backing off a mask in a lot of cases. And, I think we're just going to get to the point where it's just here. We deal with it. Try to be careful. If you feel comfortable wearing a mask, feel like you should, wear one. But if you don't feel like it, you don't have to. And get a vaccination.
Any other questions for Mr. Sharp? All right, we're adjourned.